This is for all my people out there that are in perimenopause or are pretty sure that they are. They're dealing with the lab chaos arm wrestling match with their clinicians, whether that's their clinicians telling them, oh, all your labs look normal, or just refusing to order them in the first place. This is very common, and I'm gonna break it all down and tell you what to do next. Okay, so the crux of the problem here is that perimenopause is defined by vastly fluctuating hormone levels. And hold with me here, because I know that this may sound familiar to some of you, but the problem with drawing labs at any one given time is you're catching a moment, and who knows where in that fluctuation you may be. You can try to time it with your cycle, which helps to give an idea of where things should be, but that is not totally reliable. And I know, this is why I told you to stick with me, because I know some of you have heard this already from your clinicians as justification for not ordering labs at all. Trust me, that is not what I'm saying. If you are having perimenopause symptoms that are likely tied to hormonal changes, you should absolutely have labs drawn. What I'm saying is that when you do have those labs drawn, and the lab tells you in their little black and white binary sheet that your labs are normal, that is not I mean, I could go on about this forever. I do watch my other videos, but that is not a reason to deny you treatment, to say, oh, everything's fine. It just does not work like that. And we have guidelines that back that up from the National Institute of Health and clinical guidelines overall stating that perimenopause is a clinical diagnosis, meaning that that is a diagnosis made based on symptoms and based on evaluating the patient and listening to what they're telling you. We draw the labs, and the labs are very important for establishing a baseline and ruling out other causes of those symptoms. So it is so important to do those labs to achieve those objectives, but you are ultimately making the diagnosis of perimenopause based on what the patient is telling you. That is what we have in actual guidelines and in actual science. However, with actual clinicians, not everybody is aware or chooses to use those guidelines and instead deny patients treatment. So armor yourself with those facts to advocate for yourself with your clinician, and if that is not working, find a specialist who can help.